I'm Kristen Vengler, and our mission with this podcast is to help you and the people who love you through the shock of diagnosis and treatment.
I'm Eva Shea, and the incredible woman whose story you're about to hear is a nurse practitioner in San Francisco who has dedicated her life to caring for patients more vulnerable than you can imagine.
Her name is Natasha. This is a story about what happens when you have breast cancer, told in real time. How are you feeling? You look great.
Yeah, I feel almost normal-ish. I'm maybe at like 85%, maybe a little more, 88%. Let's give it that.
That's pretty impressive.
Yeah.
Pretty impressive. To go back, there's a part in one of the last 2 episodes of my story, season 1, where I was talking about how I went back and listened to my podcast, and we were talking about sweet little naive Kristen. And I was like, yeah, wasn't she annoying? Like, she was going to walk and she was going to do this and she was going to do this. But as you're hearing the episodes unfold, how are you feeling about that? Like, about sweet little naive gangbusters Natasha?
First of all, this might sound narcissistic, and probably it is, but I really enjoy listening to them because there are things that I've forgotten, which is kind of frightening, actually. I don't know if that's like chemo brain or no idea, forgotten by choice. But yeah, it's been interesting. I don't know. I don't think I was naive for very long because once reality hit, I was having a hard time even just getting food in my mouth, let alone going for a walk. And it's something I've been thinking about today. So actually just about 20 minutes before we started talking, came in from having had a massage, which is maybe why I seem a little like, and I'm not a huge person for getting massages, but it was just, I hurt my back doing something. And I was just like, I think I'll spoil myself.
Sure.
And they give you a vinyl sheet where you have to check in like various surgeries and pains and this, that, and the other. And mine looked like a shopping list. It was like right-sided breast cancer. Please be careful of, the lymph nodes on the right. The left side, I have a port, so be careful of that. I've also had right knee surgery. It just kind of went on and on. I was like, that felt a little strange that that's something that I'll carry with me from that forever. That I will always have to write that on something.
Was that the first time you had to write it?
I think so. Yeah. And then I felt drawn that I had to show my port and say, it's fine, you can touch it, it doesn't hurt. But I was having these thoughts about whether being a cancer survivor, which I guess I am now, is like how big a part of my identity will this be moving forward?
Right.
It's been the only thing and the everything since January.
Right.
As you know, I'm still going in every 3 weeks. I'm still getting the hormone blockers, but I don't have any symptoms. I'm back at work. It's not really something that's not interesting to talk about, but it feels so far away already.
Right.
And Kristen, you and I follow some pretty good Facebook groups, California breast cancer support groups. And today I was thinking, I wonder if it's time to leave that group.
Interesting.
Yeah. And I haven't really made any changes and I haven't left the group. But just sort of curious how your sort of journey has been over for a while. And I'm wondering if you didn't do these podcasts, how much of being a breast cancer patient and then survivor do you think would be part of your everyday life?
That's a really good question because I'm a completely different person from before. And the thing is, you're living in the same house as, you've been there for a long time. And I had just moved to San Diego and was just getting my footing and COVID happened. And then 8 months after COVID, I found my tumor. I am still in those groups, but I have found myself seeing these women who are so afraid. And I found myself having so much empathy that I stay in those groups. But I guess my question is, did being a nurse give you a sense of more peace or more worry?
It was way more worry. And I think I'll take that worry with me probably for the next who knows how many years until you get your magic pill and we're all cured. And that's partly having too much information. It's partly the working in palliative care. We don't see people whose cancer hasn't recurred.
Right.
So, I mean, I definitely see some of my patients are what we would call a primary cancer. So it's their first, they've just been diagnosed. They're coming in for their first treatment. And we see people on their third, fourth, fifth, sixth regimen really, really holding out hope.
I would love to hear about your radiation journey because I think it is much more typical.
Yeah. So one of the great things that the team did for me and with me is really give me the perfect time for my appointments. So I would have it towards the end of the workday. It was usually 3:15 or 3:30. I would go from work on the scooter, park it there, go in, go through the COVID screening. They knew me so well by then, and I had all the stickers stuck all over my jacket. It was kind of funny and stupid. It was interesting. I assumed, I mean, it's so highly technical that I assumed that the 3 young women who were helping me were maybe physicians, nurses. I wasn't sure. It was a very specific and very precise job to do. So basically I would, they would come and get me. I would go in, I would lie down on the bed. They would ask again what Pandora station I would want. I would lie down. It's often cold, so they would put a blanket on me. And the first 2 sessions are different because they're putting on the tattoos and they're taking a lot of images and making sure that when you get on the table, which is what they call that sort of the bed that you lie on, is absolutely 100% in the right place.
Right.
And I think there were always 2 people in doing the table check. It's a lot like when you get chemo, where 2 nurses will do the chemo check. They don't want to, radiate the wrong place. Some people's tumors are pretty small. If you've got a centimeter, you don't want to miss it.
They would roll you just a teensy bit, right? And you couldn't help, right?
Right. You absolutely couldn't help. They would roll, and then I would feel like all I would do is just roll back because they'd rolled me such a tiny amount. But then would come the calculations with the table. It's like, okay, so 11.3. Okay, I'm at 11 point. And I'm guessing they were measuring height and tilt and everything, but that was pretty fascinating. And then they go away to protect themselves from the radiation. I mean, it's not even that noisy. There's a little bit of sound, but it's nothing like an MRI. And nothing comes across you. You're not in a tube. You're just sort of lying there, and this multi-billion-dollar looking machine is moving around. It's very hard to describe. And also you're not supposed to move. So you're not supposed to be following it with your eyes. And then within 15 or 20 minutes, it's not even that long. It's over, and yeah, you just sort of skip out and go home. But I did lose it one day on the table, which was really surprising. I did not expect to. It's interesting when you ask, did I feel like it sort of interfered with my life? And I thought you were going to say it interfered with my body. And I started to feel really on display, just tired of not having any say over what's being done to myself. And they, at this point, you'll know the song, the George Harrison song, My Sweet Lord.
Yes. I love
that. That came on the Pandora, and I just lost it. So it turns out that these 3 amazing women who run it, they're specialists in giving radiotherapy, but they didn't go to nursing school. It's like they're just kind of genius young women. It was really nice to see them.
That's really cool.
And they were great. They stopped the machine. They're like, do you need a minute? And I was like, no, I just kind of, I need this to be over. It's cute. They had the bell that you can go and ring after radiation. So we gave UCSF a hard time for not having a chemo bell, but they do have a radiation bell. And my best friend Joyce came with me, and she was going to video, and it's the most lackluster ringing of the bell, because I was just like and we've talked about this, they're all sort of fake celebrations. And I love the certificate. Yay, you got through this. But, it's like, yay, I got through it, but I'm still going for the hormone blocker. And then I'll be getting terrifying scans every 3 to 6 months. And it's,
right.
Yeah.
So did your skin change much?
I was lucky enough. I didn't have any really bad skin issues.
That's amazing.
Yeah, I was definitely sunburned. I mean, I'm so white that I've never really tanned in my life. So I was definitely sunburned. I had maybe 3 or 4 days of itchiness and was really warned by the techs not to scratch, because you scratch and then you end up with an infection, and then everything gets put back on hold again. And an interesting thing that one of the techs told me is that it actually can do a lot to help break down scar tissue in your scar.
Oh.
So they were like, oh, one of the beams is going to come very close to, like, basically go through the end of the scar and my under boob scar. So she's like, that's a really good thing. That might help. Because I don't know about some of your scars, but it was kind of knobbly and knotty, and it definitely wasn't flat. And I didn't understand why it wasn't flat, because the one under my armpit from the lymph nodes is flat. But I mean, I'm sure there's a reason. I'm not questioning their surgery.
Well, it's probably because it wasn't a flat. Did the plastic surgeon do it?
He did, actually. Yeah.
Oh,
but we're a teaching hospital, so who knows? It could have been a toddler.
Yeah, right. Exactly.
So I was pretty diligent with the creams that they gave me. And at one point, UCSF has this, it's like a sticky thing that they put on after your very first treatment on day one. And I think it was called Mepilex. So I turned out I was kind of allergic to it. Not really, but it was reddened and I just couldn't keep it on. It was just peeling off constantly. So we said, forget about it. But
yeah, well, I didn't have that until I started having really bad blisters and burns in the center because I didn't want anything touching it. And so they gave me some that were kind of thick that I could wear on there to just kind of protect it.
Right. So I've got the name wrong. Yeah, they gave me some of those Mepilex, but there was something else. And I'm sorry, world out there, I can't remember what it's called. Very, very thin plastic that you put on and you leave on for the whole week you're having the radiation, and then the weekend you take it off. And the idea is that it holds in moisture. But I just got like a little bit of a red rash. And because I was trying to put it seemed like a silly thing to be doing, because I was putting cream all around the sticky thing. The sticky thing's losing its stick and it's kind of coming off. And so, yeah, I gave up on that. And what was interesting is that also what they found was that when the nurses stuck this thing on my boob, it would move my boob very slightly. And so when I went to the therapists, the radiotherapists, they were like, why is your breast moving? You know, it's like the nipple will be in one position, then another position. It's so precise. And then they're like, oh, I bet it's that sticky thing. Can we do without the sticky thing?
Yeah. Well, that's good. Yeah. I remember having a conversation with somebody about feeling, and this is just, it wasn't for lack of compassion. Just, I felt like a piece of meat.
Yeah.
And it was because it was an important job and they had to be very precise. So there wasn't small talk. They made sure you were comfortable. They made sure that you were warm. And then once they had that handled, they're like, all right, down to business.
Yeah. I don't know what the layout of your radiation the treatment room, not clinic, looked like, but for me to get to the bed, I had to walk past all the technology.
Yes.
And because we're a teaching hospital, there would sometimes be many people back there. Like, you know, and I get it. It was just, and in a way, I wouldn't want it any other way, because I learned by watching at the same time. Yeah. But it just adds to the, like, please give me my body back. Yeah. You know, it's sort of almost going full circle from when we started talking. It's like having the massage today. There was we talked about the fact of having to list, yes, I'm a cancer patient, please be careful of my lymph nodes, et cetera, et cetera. But having somebody touch me from head to toe through my choice, was kind of remarkable.
Right. So something else happened kind of in the middle of that. I think you were finished with radiation when everybody remembered that there was a nodule in your thyroid.
Yeah. So this is something that got noticed, let's say not diagnosed, but noticed back in January when I started all the workup for the breast cancer. And interestingly enough, it showed up on the PET scan, which is where they can see from like head to toe where any cancer might be brewing. it was then confirmed with an ultrasound. Yes, you've got this nodule in your thyroid. And then I think I forgot about it, or I just assumed nobody seemed that fussed. So I wasn't that fussed. And anyway, there was something bigger that we did need to deal with.
Right.
So the last time I saw my oncologist, I mentioned, oh, is it maybe time to start doing this? And she's like, oh, yeah, sorry, we forgot that. And it's like, well, yeah.
Okay.
But I also forgot it too. I mean, I know that.
Well, I'm just going to go out on a limb and say that's not your job.
Right. Thank you.
Okay, go ahead.
So they sent me for a thyroid biopsy, which is, for those people who may not be sure, the thyroid's exactly in the middle of your throat near that notch where your head meets your neck, if that makes any sense. No, where your neck meets your torso. And I've had really no side effects from this. So, back up. So the ultrasound showed about a 1.2 centimeter nodule on the right-hand side. So come forward 9 months. Now they did the biopsy, which was a very unpleasant experience, having a sharp needle stuck in your throat, basically.
Yeah, I imagine.
I had a fellow doing it, and he was quite good, but was nervous. And so after about 10 minutes of digging around, the boss stepped in, which meant it was done in about 5 seconds. But
of course,
and then you get and here are the warnings. Like, if you stop breathing tonight, go to the emergency room. And then, about a week and a half ago, I think I got the results that it's a complicated result. It's called a follicular lesion, which means that it's precancerous cells. So some of us may have had like an abnormal pap smear, and you go and they're like pre-cancer, and you have your discussion with your OBGYN what you want to do. So from what I can understand, I think 20 to 40% of these turn cancerous. Mm. So it's that sort of, what am I willing to tolerate at this point? I think more workup needs to be done. I mean, it's a very, very treatable cancer. When I was getting the biopsy, I actually asked the radiologist, I said, if this is cancer, which it very well could be, what am I looking at? And he basically said, many, 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 many people get this. So I think where I stand, I have a meeting with a surgery group, I think in about 2 weeks. I need to get stronger. I am not in a place where I want any more surgery. I do not want any more radiation right now, if that were indicated. What I want to do is the watchful waiting. For me, the encouraging thing is that it hadn't grown between January and October. Mm-hmm. So that was reassuring. And, there was just a very different sense of urgency between how my breast situation was handled as compared to how the thyroid's being handled. So sure. It's interesting. Friends of mine are going on the freak out train again. And I'm like, no, after what I went through, that I'm really not even, I'm more anxious about the fact that the cat vomited than the fact that I might have a second cancer. I haven't been given the options from the surgical team, but I can't imagine. Maybe I can. Maybe I can. I mean, I was going to say I can't imagine an urgency, but I know less about thyroid cancer than almost anything else. And there's not much research out there to find, because it impacts so few people. Mortality-wise, I think a lot of people get it because we're looking for it, like we were saying.
So, question about that. Is it ruled out that it's metastasis? Not to bring you down, but...
yeah.
Okay.
So no, that's a great question. So my oncologist reassured me, the radiologist reassured me. They said, in all the years I've been doing this, I've never seen breast cancer metastasize to the thyroid. It just doesn't go. And also, the cell type of my breast cancer is adenocarcinoma, and the cell type of the thyroid is something called follicular.
Completely different.
Completely different cell type. That's a great question, though. Yeah.
Okay. Because we were talking about how things could spread. And if you think about it, your thyroid is inches from where your tumor was.
Absolutely. Absolutely.
Right? Yeah. Yeah. Thank you for answering that.
Yeah.
Something else that's been going on, you mentioned it a little bit, is work. Can you tell me when it became time for you to go and think about work again? What happened?
So I'd always felt guilty about taking time away from work when I felt better after chemo. I probably could have gone back a little earlier, but I had no real way of knowing how I would react to radiation. And actually, so I went back quite a bit before radiation started. I said I worked through most of it. And then I had always planned to take the week after my radiation off as vacation time because everybody had said, week 4 can really be the hardest. And so I spent that at home. And in a way, it's been great to be back at work just because I've had a year of feeling completely unproductive, kind of useless. I mean, I've talked about this a lot. I feel like I've slept since January to September. So it's really nice to be around other colleagues, and it's interesting to have people ask questions. We were rounding on a patient in the ICU, unfortunately, who has a recurrence of her cancer. It's what we call a head and neck cancer. So it was, I think, tonsil cancer. Yes, that's a thing. And the team was having a really hard time managing her symptoms, and she had a lot of mouth pain and ulceration. And I was like, have any of you guys, tried salt and soda? And they're like, huh, what? I'm like, oh yeah, when I was going through chemo, salt and soda, blah, blah, blah. So it's, like, it feels useful and it's a positive way of using my experience. And then next week, finally, we've been talking forever. So I'm still just doing inpatient work, which is intense, but I have much more of a team around me. They've got like a primary team and often a bunch of consultants. Next week, my clinic starts on Tuesday, where it's just me and the chaplain that I work with, and possibly a social worker, but I'm not sure, meeting for an hour with each patient back to back to back who is not doing well. So that's going to be, next time we talk, we'll see how that's been.
Yeah. Well, and I have to wonder how much, like, what is it you said when they did the MRI and they couldn't find anything? It was
unremarkable,
right? Or unappreciated or something like that. And so your chemo basically cured you.
Yes.
In a sense, right?
Yes, it did.
And so what I wonder is, knowing that, there's probably a little more confidence that you might have going into it, as opposed to if you may not be back at work if it was a different situation.
Right.
But I remember your concern of bringing your feelings in with your patients. And I mean, you're walking around with no cancer now.
Right. And it's sort of making me think back to what we were talking about at the beginning about how I've looked at signing out of some of the Facebook groups. And as you were explaining sort of your reasoning for staying, it was reminding me of how much information I got from other women. And now, even from like day one, nobody knew me. I posted, this has just happened. Such an outpouring of support meant so much to me from this group of women that I absolutely didn't know. And now, if I can maybe take a break and go back with a different mindset of the little things I've chipped in on, like anytime I see somebody who's like, I don't think I should get a port. I don't think it's worth it. I don't know. Ports sound terrible things for infection. I'll pipe up straight away. I'm like, I love my port. No infection. Like, I don't even think twice. And there was somebody the other day who was really, really nervous about getting chemo and was thinking of not doing it. And could anybody offer any of the positives towards doing chemo? And I just wrote 2 lines. It saved my life. It cured my cancer.
There you go.
Yeah.
Right.
It's interesting. I say, like, I feel like I slept a year, but many nights up until 2, 3, 4 a.m., I was reading other people's postings because it just made me feel held, and like this wasn't just such an anomaly that only ever happened to me.
Right. Because you can't imagine that anyone has felt the same things that you're feeling, because we're also individual. And so we can't possibly imagine that someone else is feeling like that. And I think that's part of how people started listening to this. We had a woman write in She was from the UK, and she said, I just had to write because I laughed out loud, and I haven't laughed out loud in 6 months. She said,
Oh,
it was
that's
when
so
you said that
nice.
you shook your head and your hair moved. She's like, I'm not there yet, but it's going to get there. And so, whatever it is,
Yeah.
if something resonates with someone and it makes people not feel alone, I mean, that's kind of like holding their hand through verbiage, right?
Yeah.
And there were times when I actually would direct message people rather than writing something on there.
Oh, I haven't done that. Yeah.
And I would say, hey, my story's very similar, and I just want to let you know that I'm here with you. And so I think you'll get some of that same feeling continued when you're doing your work.
Yeah. I'm not sure. We'll find out. I think what it gives me is more information that's actually from evidence, from an experience rather
Right.
than what I've read in books. I mean, I know I've brought this up a few times, but I'm horrified by the fact that I have told patients each chemo cycle is different. So however number one goes, that's how the rest of them will go. And that's not true. That is
Right.
not what I lived. I don't think it's what you lived either. But that's the spiel. And I will never give that freaking spiel again. And I want to talk to some of the other nurses where I work and say, hey, be careful with giving that because that's not true.
Right. I remember getting a text from you a couple of weeks after radiation. And you said, I guess it's normal to feel a little down when treatment's finally over. It's been a weird day.
Yeah, I do remember that. And it's interesting that I'm also saying treatment's finally over when it actually isn't. But I think there's something that you've shared with me about the strangeness of having a checkpoint every day with people. Yeah, it's only 3.5 weeks, but I knew the people who were taking care of me. They're like, hey, Natasha, how's the bike running? What I mean, they would just have little chats at the front desk. And then you wake up the next day and nobody's called and nobody's checking in on you. And it was just a little, yeah, I think like I was saying, my sort of lackluster ringing of the bell was just like, I don't know. I'm waiting for the fireworks and the big celebration.
Well, I also think that we feel like there's going to be something inside of us that clicks, and all of a sudden we're super relieved and we feel cured and we're ready to go. And hormone blockers, whether it's intravenous for several more months or whether it's a pill, that's still going on. And a lot of people are still having side effects from the treatments.
Exactly.
But I think that I used to get all butthurt that my family and friends, and there were some that were still checking on me. But after I was out of the critical stuff, I didn't hear anything. And that's when I really needed somebody.
Yeah. No, I was sharing that with someone the other day, how way before treatment, just after my diagnosis, the fridge is full. People are bringing stuff and like the house felt like we saying like Piccadilly Circus, it was just like people coming and going. And I felt fine because the stage my cancer was caught at, I had no symptoms from it other than a lump under my arm that didn't even hurt.
Right.
So I didn't need taking care of at that point. But yeah, with them when I did, like around cycle 3, and this, for those of you who may not have listened to the whole season, I actually went through a kind of unexpected divorce right before my diagnosis. So I was not in the best space when I got my diagnosis. And, I have a couple of friends who's like, it's been hard to be your friend this past year or so because it just seems like there was so much going on. And that was hard to hear, but I appreciated that they could actually say that.
Well, right. Yeah.
And yeah, it's interesting. As he was saying that, I realized that I need to change my vocabulary. I don't have cancer.
Yeah, Jack agrees. Jack agrees.
Thanks, Jack. I wish you'd told me. I guess, we're both at the point where we had it.
Yeah. And I had to change my vocabulary too.
Yeah.
To when I had cancer.
Wow.
Or, now without cancer, blah, 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 whatever. And I don't start my sentences like that, of course.
Oh, you don't? I start every one of them.
Now that I don't have cancer.
Right. When I had cancer, it was, it's like a trip, like when I was in Portugal.
Yeah. Did you have that feeling like at times, like you still didn't believe it?
Yeah. Oh, I still don't believe it.
Right. Okay. Thank you.
I actually feel like it was part of nursing school, and it's something that I actually had to go through.
Well, see? Yeah, I know. And I still like, I think about it and then I'm like, oh yeah, because I don't want to dwell on it. Like I'm not a professional cancer patient.
I might be a professional thyroid patient. We'll see how that goes.
Sorry.
No.
Thank you for listening to Breast Cancer Stories. To continue telling this story and helping others, we need your help. All podcasts require resources, and we have a team of people who produce it. There's costs involved, and it takes time.
If you believe in what we're doing and have the means to support the show, you can make a one-time donation or you can set up a recurring donation in any amount through the PayPal link on our website at breastcancerstoriespodcast.com/donate.
To get the key takeaways from each episode, links to anything we've talked about, and promo codes or giveaways from our partners, sign up for our email newsletter.
You'll get notes and thoughts from me related to each episode and links to the most useful resources for all the breast cancer things. So if you have chemo brain, you'll be able to just go read your email, find anything we talked about on the podcast without having to remember it.
The link to sign up is in your show notes and on the newsletter page at breastcancerstoriespodcast.com.
We promise not to annoy you with too many emails.
Thanks for listening to Breast Cancer Stories. If you're facing a breast cancer diagnosis and you want to tell your story on the podcast, send an email to hello@theaxis.io. I'm Eva Shea, your host and executive producer. Production support for the show comes from Mary Ellen Clarkson, and our engineer is Daniel Cruiser. Breast Cancer Stories is a production of The Axis, THEAXIS.io.